Jay Norix, and I'm the developer of Parts and Memory Therapy, which in my previous books I call Parts Psychology. Today we're going to take a little detour from our planned video to do a short intervention on migraines. We're going to show you how, at least in some cases, at the beginning of a migraine, we can use Parts and Memory Therapy to reduce, if not altogether heal, that particular presentation of a migraine. The procedure has 4 steps. Number 1 is locate the body sensation that the patient feels. In this case, the patient, Nadine, experienced the beginning of her migraine as an aura, which is a sensation she felt that always preceded the migration of the migraine to her left eye. Step 2 is to bridge from the body sensation, in this case the aura, to the very earliest disturbing memory that comes up as Nadine allows her mind to float gently back in time through her 20s and her teens and her childhood to the earliest disturbing memory that comes up. In this case, it was Nadine's repeat of kindergarten. And the situation was that she was on one side of a fence, and her previous kindergarten, now in the 1st grade, were on the other side of a fence. She was confused and somewhat hurt that she was separated from her previous kindergarten mates. The confusion she felt was then the target of our intervention. So we neutralized that confusion through a fantasy intervention. In this case, Nadine took rain as a fantasy intervention, imagined the little girl being soaked through and through with rain, which then dissolved and carried away the confusion she felt about being separated from her first kindergarten. Once that negative energy, the measure of the negative emotions was at a 0, we went back then and checked to see if there was any change in the original sensation, and there was. The aura was gone. There was no pain at all. Now, a couple of notes. In this case, we kept the camera off of Nadine's face because she is volunteering to do later work in which she might want to keep her identity confidential. A second note is that during this process I asked Nadine to speak out loud in response to my guiding her in the intervention. I did that so that you could be in on it, but usually patients prefer to do their inner work silently as they direct their thoughts to the child parts or other memory elements that they work with. And the final note is that we cut this little piece out of a longer piece that you'll see in a later video. But we did this just so you could see encapsulated how Parts and Memory Therapy can sometimes help migraine headaches, at least when we catch them at the beginning stage. Nadine, can you tell us what it is that you're feeling?
So I'm feeling the aura before the migraine begins. So it's just a sensation in my head, this pain in my head.
No pain yet?
It's a little painful in my head, yes.
So on a 0 to 10 scale, how great is that pain?
About a 4.
About a 4. And so we're going to focus first on the aura. How do you experience that? Can you put it in words?
I would say it's hard to put into words, but it's just a little bit of pain before the migraine gets really bad. Because when I experience the migraine, it's usually behind my left eye, but when I experience the aura, it's around my whole head.
Your whole head?
Mm-hmm.
Okay. But we're going to use that aura to try to bridge to something else in your previous life experiences that are maybe linked to that aura right now. And if so, we might be able to neutralize it.
Okay.
So focus now on that aura, however it is that you experience it.
Okay.
And as you stay connected to that aura, let your mind float back in time to the earliest memory of any kind that comes up. Back through your 20s and your teens and your childhood. What is the very earliest memory that comes up?
So I remember being in kindergarten. It was actually my second time in kindergarten. And we were at recess, and the kids that I were in kindergarten with the year before were in first grade, and I remember grabbing onto the fence when I was at recess, wondering why the other kids were on the other side of the fence in first grade, and I was still on the kindergarten yard.
And is that memory upsetting to you?
Yes.
What is upsetting about it?
I was confused, and I didn't know why I was still like I was left behind.
Mm-hmm. Were you embarrassed?
Yeah.
Looking back, maybe as a kindergartner you wouldn't know what that is.
Yeah, I might have been embarrassed, just confused, and
So let's go with that.
okay.
Can you see yourself as a kindergartner in this memory?
Yes.
All right. So say hello to her, to that little girl, the kindergarten you,
Hello.
and ask if she knows who you are.
Do you know who I am? She said yes.
She says yes.
Mm-hmm.
And who is that? Who does she say you are? If she says she knows you.
You are me.
And ask if she understands that you are her, all grown up.
Do you understand that you're me, all grown up? She says yes.
She does. Okay. And tell her that what you're going to try to do now is to help her let go of her confusion. Would she like that?
I'm going to try to help you let go of your confusion. Would you like that? And she says yes.
All right. And so we can help her take her confusion and throw it away into the trash, or we can wash it away with rain or a shower or any other means. We can burn up her confusion in a fire if she'd like that. What would you like to use? And you can pick your own, as long as it symbolically says we're getting rid of this negative emotion forever. What would you like to use?
Rain?
Wind?
Rain?
Rain. All right then. You can see the little Nadine, and so just speak to her and tell her to experience what I'm telling you, which is to allow the rain to fall over around her and through her and soak her from head to toe, and tell her to feel how the rain dissolves and washes away her confusion and any other bad feeling she has. Tell her that out loud, please.
Now just feel this rain dissolving any confusion that you have. as it pours over, around, and through you.
And what's happening now?
She doesn't feel that confused anymore. She feels happy.
She's happy. Excellent. And thank her for talking to you.
Thank you for talking to me.
And then tell her to go ahead and play. And then you come back, please, and examine your own aura and tell me if there's any change.
Okay. You can go play. It's gone.
The aura's
The
gone.
aura's gone. Mm-hmm.
And did the headache gone? The beginning of the migraine?
Mm-hmm. Yeah, the aura's gone.
The aura's gone.
Mm-hmm.
And you said the amount of pain was about a 4 on a 0 to 10 scale.
Mm-hmm.
And what do you feel now?
0.
0.
Mm-hmm.
All right, good job. All right.
Mm-hmm.
Very good. And I'll tell everybody that what you just saw was completely impromptu. I didn't know that we were going to do this, and Nadine stepped right up and presented herself for the possibility that we could provide some relief, and we're able to do that very quickly. And you saw how we actually went back to an early memory, neutralized that, and that was a basis for the relief of the aura that she was feeling with the beginning of her headache or migraine.